This episode is sponsored by Friskies, who would like to tell your cats hi. Now, if that didn't get your cat's attention, there is one thing that always does the trick. Just pour some Friskies crunchy food in the bowl and you'll hear those paws come running. Works every time. With so many Friskies choices, you can always bring your cats running from their secret napping spots. There's always more to explore. See for yourself at friskies.com or visit your local store.
Building a portfolio with Fidelity Basket Portfolios is kind of like making a sandwich. It's as simple as picking your stocks and ETFs, sort of like your meats and other toppings, and managing it as one big, juicy investment. Now that's pretty good. Learn more at fidelity.com/baskets. Investing involves risk, including risk of loss. Fidelity Brokerage Services, LLC. Member NYSE SIPC.
Media Podcast Network presents This is Protecting America. Now, here's Emmy-winning journalist Rita Cosby.
Welcome to another edition of Protecting America. I'm Rita Cosby. Former President Joe Biden has revealed his aggressive prostate cancer diagnosis. So how serious is it? And why didn't we know about it sooner? Well, joining us now is Dr. Marc Siegel, Fox News Senior Medical Analyst and also doctor and professor of medicine at NYU Langone Medical Center. Dr. Siegel, great to have you here.
Great to be with you, Rita.
Sadly, how far along do you believe President Biden's cancer is?
Well, it's very far along in that under the microscope, it's been found to be very aggressive, Gleason 9, which means it looks like high likelihood of spread, and they've already found an area of spread in a bone. It usually goes from prostate to lymph node to bone, so at least it hasn't spread beyond that, and at least there's only one example in a bone, but it's a very aggressive cancer, and it's already spread. That makes it stage 4. It's metastatic. The only silver lining here is that they're also saying that it's responsive to hormones because it must have a high testosterone content. So if they use an anti-testosterone drug that prevents testosterone from being made or blocks it from being uptake, then you're going to see some clinical response. Hopefully it'll shrink in the bone. Hopefully it will shrink in the prostate and it won't spread anywhere else. They can use other treatments, including radiation, and potentially even remove the prostate to improve the ability to control it. But long-term prognosis isn't great, and 5-year survival rate is likely under 35%. So he's got a tough road to go.
You talked about the different treatments. What is the most likely in this case? Is it the hormone? Is it the removal? What are sort of the normal steps?
Well, one thing I would like to be saying, former president of the United States with unlimited resources, is that we should be looking at state of the art here, because these days we're starting to use artificial intelligence. We're starting to use individualized care, personalized medicine. We're starting to analyze the genome to figure out what kind of genomic pool you're in. That will dictate response. It's not one size fits all anymore. Having said that, what we're being told is that he's going to start with hormonal therapy, not with targeted therapy, not with immunotherapy, not with chemotherapy, not with removal, not with radiation, but with hormonal therapy that will hopefully shrink it, meaning, again, to fight off that testosterone effect, which causes prostate cancer to grow. I would also suspect they might do something with that metastases to the bone. Maybe they would radiate it.
You talked about the hormonal therapy, sort of the focus. Is that a more milder, is that more palatable, if you will, for the patient?
It's not that palatable. It causes a lot of fatigue, decreased libido. It's got side effects. All of these treatments have side effects. But we're not taking anything off the table because somebody's over 80. And that leads to the next point, which is how well was he screened to begin with, and when was this diagnosed?
Yeah, that's the big question. How come we're just finding out about it now when it seems like it was so far along?
I think there's two possibilities here. Either they didn't do a full court press screening on him, even though he was president of the United States, A, or B, they're not telling us the whole story here. Now, you could choose which you think it is, Rita. You're a really, really savvy person. I actually don't know. 1 minute I think one thing, 1 minute I think the next. But I'll tell you, the entire country knows they weren't being completely honest or forthcoming regarding the president's cognition. And I was telling the public that over 4 years ago. So he was having problems concentrating, problems with orientation, problems with memory, not just over the last year, but even before that. They were not forthcoming. They attempted to hide it in his yearly physical. So what else were they hiding? Could they have been hiding a known prostate cancer diagnosis? We don't know. Prostate cancer itself causes fatigue and side effects, whether there's treatment or not. I would be more inclined to think that they just didn't do a good job screening him. I'm telling you right now that I do a prostate exam and a prostate-specific antigen, which looks for an abnormality in the prostate in every male over the age of 45, and I don't shut it down over the age of 80. Maybe people are looking closely at guidelines that I don't agree with, not only for a president, but for any of my patients. I continue to do that. And then we're having even more screening tools come out, biomarkers in the urine, genetics I talked about already, the free PSA, which is low when you have prostate cancer. There's a lot of ways that you can screen, and I'm hoping he had these, but he may not.
Wouldn't it be astounding to you if he didn't? Here he is, the president of the United States. It wasn't that long ago that he left office. That's shocking to me because it is a fairly basic test that he wouldn't have been checked for it because it seems so far along that it would have been picked up.
Well, he had his yearly physicals we've checked, and they didn't have the word PSA in them. Obama's did, Bush's did, Trump's do and did. Biden's didn't say the word PSA.
Could that have been eliminated on purpose?
It could have been eliminated on purpose if it wasn't done, or it could have been eliminated on purpose if it was high. Either way, I don't like anything being eliminated on purpose. Now, look, we have a long history in this country of obfuscating and hiding presidential health from the public. That doesn't make it right. And that goes all the way back to the beginning of the presidency, but was notable with Woodrow Wilson, who had Spanish flu that influenced the Treaty of Versailles, who had a stroke and his wife was running the country. FDR had severe heart failure in his latter days, and people didn't think he was going to survive that last term, and he didn't. Eisenhower was having heart attacks in office. Ronald Reagan, as you know, lost 2/3 of his blood after being shot. I mean, it goes on and on. I think in the latter days, it's been less the case. I mean, Bush was pretty transparent about his health. He was in great health. Obama was transparent about his health, and nobody's been more transparent about the health than President Trump. We know how many Diet Cokes he has every day. We don't love it, but he tells us the amount. We know when he's on the golf course. We know what his weight is. We know everything about Trump. We know what his blood pressure is. I have a really bad feeling about the obfuscation and the hiding that went on when President Biden was in office. And, it may have been what cost him the presidency.
Smart Water Alkaline with antioxidant. 9.5 plus pH, now in cans.
Refreshing.
Made for every way you move.
Should I run a marathon?
Let's start with finishing that water. Smart Water Alkaline with antioxidant, now in a sleek can. For those with a taste for taste. Grab yours today.
This episode is brought to you by Temptations Cat Treats. Your cat will come running for the perfectly irresistible Temptations Creamy Puree and Temptations Lickable Spoon Cat Treats. The best time to feed lickable cat treats to your cat is anytime. Feed by hand for a playful moment, in a bowl for a creamy treat, or as a topper to make mealtime fun. Visit TemptationsTreats.com to learn more.
Ryan Reynolds here from Mint Mobile with a message for everyone paying big wireless way too much. Please, for the love of everything good in this world, stop. With Mint, you can get premium wireless for just $15 a month. Of course, if you enjoy overpaying, no judgments, but that's weird. Okay, one judgment. Anyway, give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.
Learning through play starts with Lego Duplo. With Lego Duplo, toddlers can develop real-life skills while having fun with colorful bricks made just for them. Large, easy to grip, and safe to explore. When children express themselves with Lego Duplo, they build patience, problem-solving, and empathy. See your child learn perseverance and self-expression with everything they imagine and create. Visit lego.com/preschool to learn more.
You know, his doctor is this Dr. O'Connor. That was the White House doctor, but he had already had like Biden connections. Is there a sense that maybe this guy needs to testify before Congress? Because to your point, it's much bigger than even Joe Biden. Of course, we're praying for the president and his family for sure. But there's a lot of layers to this, Dr. Siegel. It's a national security issue if there's being something hidden about somebody's health.
You know, there's a lot of finger pointing going on, Rita. I think somebody better testify. I don't know if I would limit it only to O'Connor. They're saying that. You know, President Trump was saying today, Walter Reed is a great institution. I agree with him. It's a great institution. I don't know how much of this is covered by patient privacy. Believe it or not, that's still in play even with the president. I don't know who should testify. But I'll tell you one thing. I'm old-fashioned, and I don't believe in lying on a document. I don't believe in misleading on a document. I don't believe in obfuscating on a document. I'll give you an example. With all the discussion going on about the President Biden's cognition, you never saw the word MRI there either. You didn't see PSA, but you didn't see MRI. And so I would have found it a lot more reassuring to find an MRI that was clear, but maybe that wasn't possible. That's what I'm calling obfuscation.
Yeah, those are great points. I mean, is it possible also that maybe he was already getting treatment while he was in the White House? It seems like so many things haven't been revealed. And could that have been part of the reason maybe his mental acuity was not high, you know, that he seemed very foggy and he seemed obviously clearly cognitive decline. We could hear it in the Robert Hur tapes. Could maybe treatment be part of it or even the disease be part of it?
Either way, I mean, he could have been receiving treatment that caused him to be confused or tired or disoriented, or it could have been the actual prostate cancer itself. One thing's clear, he had it. You don't just get this overnight. That's another either deliberate or inadvertent attempt to mislead the public. Hey, I got advanced prostate cancer. Well, you didn't get it yesterday. You got it years ago. Question is whether anybody knew about it, but clearly he had it while he was in the White House.
Yeah. How long do you think likely to get to the stage, or is it different in every person? We heard from Dr. Ezekiel Emanuel, Dr. Siegel, and he was, you know, ex-Biden and Obama advisor, you know, a lot with the Obamacare issues, but he came out and he actually surprised, I think it was the MSNBC host, and he said he thinks clearly he's had this 100, 200 days plus.
Well, look. Zeke Emanuel is not my flavor politically. He's the one that talked about limiting lifespan over the age of 75, life years. He has a lot of theories. Obamacare, that I debated him publicly on Obamacare. I believe that he was either deliberately, he was the Obamacare architect, and they were extending really poor insurance to a lot of people to make the insurance companies richer. And that we didn't need that scam. I didn't and don't have a problem with the Medicaid expansion at all, though I think that there's a lot of waste there that has to be dealt with. Hopefully will be dealt with now. But as an oncologist, he's quite good, but quite good as an oncologist. But I don't think he can say this has been around for 6-7 years because it's very aggressive. So it could have grown quickly. We don't know how long it's been around. We can't give a year to it. But we certainly can say it's been several years. And I don't know, why he's coming out. I don't know what is going on with the Democrat Party. Maybe they're trying to throw Biden under the bus because he's completely damaged and destroyed their party. But having said that, he had prostate cancer when he was in office. That's for sure. Yeah, for sure. Right. And it would be, to me, it's almost stunning that it would be some new revelation because as the president of the United States, you have the best care, right? I mean, typically, what kind of checks do they typically do for presidents? I mean, I would imagine they check everything. Well, I don't even think it has to be just the president. What I've been saying all day long today and yesterday is I want a PSA on everyone. I want a prostate exam on every male over the age of 45. Why would you stop? What are you saying when you stop, Rita? Go ahead and die? What is that? Why not? Why wouldn't I, as a doctor, want to know what it is my patient has? That's how I was trained. I never understand stopping something. Why wouldn't you want the information? Then when you have the information, you decide how aggressive you are and what you want to do about it. But people over the age of 80 are far different, than they were 10, 15 years ago. I mean, look, my boss is 93 years old, as you know, and he just got married again.
Right.
So I think that we are extending quality of life longer. I think we have the better tools to do so, and I think we need to use those medical tools.
Absolutely. So your advice is, as you're talking about, obviously go beyond the 70 years. Why ever stop, right?
I think those guidelines are ridiculous, and they're actually most likely written by people that have never practiced medicine.
What kind of warning signs, too, for people listening out there? Obviously, the PSA tests, the results are one. Is there family history? How much do other things play a role?
There isn't. Family history is hugely important. There are no warning signs because prostate cancer is asymptomatic for the longest time. So you can't look for urinary symptoms. By the time you have urinary symptoms, you're in trouble. Most of the time, there's no symptoms whatsoever that are directly relatable to prostate cancer, which is why the prostate-specific antigen and the free PSA and biomarkers in the urine and genetic testing, all of that is and liquid biopsy, where we're going to be able to look for abnormal proteins in the blood. All of that is becoming more and more important, and the digital exam. Now, the digital exam being normal doesn't mean you don't have prostate cancer because you're only feeling the back part of the prostate. It doesn't mean that. But it's still something that we need to do in conjunction with the PSA on everyone.
How
every male.
I was about to say, and how more reluctant are guys at getting sort of the regular checkups than gals that you find?
Well, there's something gender specific to that, but it also has something to do with women going to gynecologists beginning at a young age, having an obstetrician if they're having babies. They're more used to going to doctors than males. Males may have some kind of machoism wound up in that. But I think it's very important as a physician to get a rapport with your male patients so that they don't live in denial like that.
How common is prostate cancer, too? I mean, how prevalent is it?
This is going to shock you, but over the age of 80% of males have some prostate cancer, some degree of it.
Wow.
Now, it may not become clinically relevant, but it's enormously prevalent.
And when you say it may not become prevalent, is that because they live with it, and at that point, because of their age or their situation, exactly, they just allow it to go untreated? Correct? Is that knowingly, right?
It may not be what kills you. It may not even become clinically apparent. It may take years to build up to where you need to know about it. Dear Michael Baden, who is one of the top forensic pathologists in the world, dear friend of mine.
I love Dr. Baden, by the way. What a wonderful man.
Baden has a great line. He said, the things that you live with are far more sinister than the things that kill you. That's my favorite Baden line.
And what a great guy. But your point is that many people over a certain age, guys, will live with it versus go through some very tough treatments just because it takes a long time to progress. Is that why?
No, exactly, and that's to Ezekiel Emanuel's point that you have it for years before it gets to this point. And something happened to his prostate cancer, Biden, where it suddenly turned aggressive. I don't believe it was this aggressive for years. Probably started indolent and then became more aggressive. That often tends to happen.
Anyone can follow. It takes something special to be an original. Which is why the 2025 Lincoln Navigator SUV arrives with new ways of surrounding you in luxury, including the ultra-wide 48-inch panoramic display and the multi-sensory Lincoln Rejuvenate experience. A true original never stops evolving. So meet the 2025 Navigator, the original that's all new and better than ever. Learn more at Lincoln.com. Lincoln and Navigator are trademarks of Ford or its affiliates.
This episode is brought to you by Chevrolet. Chevy certified service technicians are factory trained to fit your vehicle with the tires specifically developed for it. And with our tire price match guarantee, you get the best fit for the best deal. Let us do the work. Available on select eligible tire brands at participating dealers only. Offer ends 12/31/2025. Terms apply. See dealer for complete details. Visit Chevrolet.com/service to learn more.
Hi, this is Joe from Vanta. In today's digital world, compliance regulations are changing constantly, and earning customer trust has never mattered more. Vanta helps companies get compliant fast and stay secure with the most advanced AI, automation, and continuous monitoring out there. So whether you're a startup going for your first SOC 2 or ISO 27001, or a growing enterprise managing vendor risk, Vanta makes it quick, easy, and scalable. And I'm not just saying that because I work here. Get started at Vanta.com.
PMS, pregnancy, menopause. Being a woman is a lot. Ollie supports you and yours with expert solutions for every age and life stage. They just launched 2 new products exclusively at Walmart. Period Hero combats bloat, mood swings, and more during PMS. And Balance Perimeno to support hormonal balance, mood, and metabolism during perimenopause. Grab yours at Ollie.com. Ollie! These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Explain the different levels too, because you talked about it's Gleason 9. There's obviously it's a 1 to 10, so that's pretty high.
Yeah, 10 is being the highest. 9 means that under a microscope it looks aggressive. It's spreading. It's dividing. It's going to go beyond the prostate. That's what aggressive is. It ain't going to stay as it is from month to month or year to year. It's going to grow and spread. That's what the Gleason 9 means. Group 5, which is the highest group. That's another indication that the microbiology of it is that the cellular component of it is bad.
And it's obviously stage 4. Can you explain, because I think it's so important, explain how far along, what that means for people listening?
Stage 4 means that it went beyond the prostate and beyond the lymph nodes. Lymph nodes would be stage 3, into an organ, a neighboring organ or a distant organ. In this case, the bone. Bone is always the first place it spreads, so that's where his is. And a solitary met in the bone, if that's all he has, that may be treatable if the hormone therapy works.
What is the option, too, if it's not? Then it goes to radiation, other layers, right? They sort of keep testing?
Well, all of these things can be taken together. In other words, he might have radiation. He could still conceivably have the prostate out. These days done by a robot, it's a very simple procedure without a lot of blood loss, if any. He might have radiation to the bone lesion. He might have radiation to the prostate still. But the key here in shrinking this is initially at least going to be the anti-hormone therapy to block testosterone.
How painful is it when it gets to the bone? A lot of people talk about that when it does get to that point, just even from a physical standpoint, no matter the age, it's often very painful.
It is painful. And the prostate cancer itself is quite painful to the bone, and he's going to have pain meds for that, or treatment to the bone, to shrink it will help with the pain as well. They got to get that bone lesion out or shrunk as soon as possible in terms of controlling the pain.
Do you think maybe this may serve as a wake-up call to a lot of people? Often you think about sometimes when you see these high-profile individuals, no matter the age, maybe if there's a silver lining, it gets others to get tested.
I think it will. That's why I'm looking into the camera every day, throughout the day, saying, get tested, get tested. And again, I don't know whether he was tested or not, but I want everybody to get tested. And let's throw these guidelines out the window. They're way out of date. Think about it, Rita. Why would a guideline that tells you not get tested make any sense when we have advanced treatments that have minimal side effects that work now if you have prostate cancer?
Right, exactly. Why would you ever not do it, especially when it's something that's not so invasive, that's fairly routine, very much routine, and with the incredible technology that you know all too well. Well, Dr. Marc Siegel, thank you so much. Everybody be sure to subscribe and share to this podcast. And boy, I think we all learned a lot about something that's very important to so many people near and dear to us. And obviously the bottom line, get tested and make sure people you love get tested as well. Dr. Siegel, thank you so much. We love having you here. Thank you.
Really great to talk to you today, Rita. Very important. Thank you.
And everybody, I'll be back soon with another great edition of Protecting America. And of course, you can catch me every weeknight, 10 p.m. to midnight on the legendary WABC Radio. This is Rita Cosby, and thanks for all you do to protect America.
Americans love using their credit cards, the most secure and hassle-free way to pay. But D.C. politicians want to change that with the Durbin-Marshall credit card bill. This bill lets corporate megastores pick how your credit card is processed, allowing them to use untested payment networks that jeopardize your data security and rewards. Corporate megastores will make more money, and you pay the price. Tell Congress to guard your card, because Americans lose when politicians choose. Learn more at guardyourcard.com.